Hey everyone, I thought we'd take some time and talk about Medicare for All strategy. So I am somebody that I personally like strategy, planning, vision, the big picture kind of thing. So I also wanted to bring up a strategy idea or tactic. It's not an old one, but I just thought I would bring it up for discussion because there's actually a lot of things happening around this one particular subject. And what that subject is, or that particular strategy is, what if the fastest way to get Medicare for all is through the state level? So, and this is something that actually, if we go back to 2019, Ro Khanna actually introduced a bill in 2019. It was HR 510. And it was called the State-Based Universal Healthcare Act of 2019, right? It was basically a waiver program to pave the way for states to do, a state administered healthcare, Medicare for all type system, okay, at the state level. So I just wanted to talk about that because there are actually multiple states right now who in 2021 have introduced legislation or there's organizing and mobilizing happening around getting a Medicare for all type bill on ballots. So there are a few, and so I wanted to also share what's happening there because just from what some of the research I did, I didn't look at all 50 states, but there were actually more states doing stuff than I realized, and it's really kind of exciting, right? So, and one of the things too that you often hear me talking about, and this is my overall view on just on strategy around organizing and mobilizing, is that we look at like micro level organizing and mobilizing around the macro level, which is the federal government, right? The House, the Senate, presidency, Supreme Court, like on that level. And then there's the micro level where we take it down to the states, counties, and cities, right? We're talking about school boards, we're talking about assembly members, state senators, and then, House representatives and governors and things like that, right? So macro level and micro level, because like strategizing and mobilizing for each one of those is different, but they're also tied together, right? Because we can look at massive issues that we're working on, like Medicare for All and Green New Deal. Those are massive things, but activities and things around that, activism and again organizing and mobilizing could happen around like Green New Deal on a national level. Like recently the Green New Deal was reintroduced just a few weeks ago, and then doing Green New Deal type things on state, local, and city levels, right? And so same thing with Medicare for All, right? So I've been looking at this thing in how do we get healthcare coverage for all Americans, right? From the moment you're born to death, right? Because really the goal with Medicare for All is again to get that coverage for every American. That also includes dental and vision and hearing aids, again from when you're born to when you die, for every single American, right? And so when you are sick or not well, you can go to the doctor. It's free at point of service. If you need prescription drugs, you can get them at a reasonable price. If you need an ambulance, you can just call and they will take you to the hospital. You will never have to worry about massive bills or going to debt or bankrupt or risking death or dying because of costs, right? That's ultimately the goal. So often I think about like, well, how can we get this the fastest, right? This kind of coverage for the fastest. And what also have other countries done in order to get some level of universal health care for all their people. And our neighbors up in the north, Canada, the way they got their universal health care coverage is they started province by province, right? It started with Saskatchewan in 1947. They were the first province to offer universal health care to their citizens, and then eventually over the next 2 decades, province by province, it got to the point where every province in Canada offered healthcare coverage for all their citizens, right? Some of their plans different from provinces, but they all have similar things where if you get sick, you go and you don't worry about costs, right? And your drug prices are low. They're not outrageous like they are here in the United States. So how do we get there faster? And also, how do we break down again the organizing and mobilizing? Because for some people, like doing things on a national level is too much, but you know, getting involved in things at the state level or county and city level is much more digestible and easy to do because it's local, it's by your house, and it's not overwhelming, right? So in all of these things too, we can do simultaneously, right? Like again, at the national level with Medicare for All, there's HR 1976, Medicare for All 2021 Act. And then at the state levels, which I'll go into, like multiple states right now have introduced a Medicare for All type bill in 2021. Now, just before I go to the states, back to Ro Khanna's, bill on state-based universal health care. So there's when it comes to Medicare for All on the state level, there's two big issues that have to be addressed. The first is Medicare. So the government, on the macro level again, the government manages like 20% of healthcare spending, which in related to Medicare, right? So that covers about 60 million people. So that's a huge amount of money. A huge number of people. 20%. Okay, so we got Medicare, and then there's the government also regulates large private health plans that primarily deal with large companies and corporations, okay, under this thing called ERISA. So it's an acronym for the Employment Retirement Income Security Act, okay? So that deals with a lot, again, insurance, retirement, a whole lot of plans, right? So on the state level, for the states to integrate their plans, those two big issues, Medicare and ERISA, like need to be addressed. So with Ro Khanna's bill, I'm just going to read you something. The New York Times actually did an article on this back in 2019 when he introduced it. And so I just want to read you this part that kind of goes into what this bill was about. So the Khanna legislation would try to get rid of those hurdles, meaning Medicare and ERISA. It envisions a waiver that would allow states to take over the Medicare money that flows their way and combine it with funding for Medicaid, the Affordable Care Act marketplaces, the TRICARE program that covers military families, and funds for veterans health care. A state would need to submit a plan for how it would use those funds to cover at least 95% of its population within 5 years, then cover the remaining uninsured within a decade, right? So that's the synopsis of what Congressman Khanna was trying to do to help pave the way so that the states couldn't, come up with excuses like, oh, well, the federal government, we have this and that. So he was trying to eliminate some of these major roadblocks and hurdles. That bill didn't go anywhere, but it can be reintroduced again, right? Again, to help pave the way for states to implement their own version, a Medicare for All type version in their state. So So let's go through some of the states that actually have some active legislation right now. I didn't go through all 50 because that's a lot, but I did find more than I was actually expecting. And some of you have heard of some of the big ones, right? Like in California and New York. So let's go through. So starting with California, I live here in California. It's called CalCare AB 1400, and what's incredible about this one is that this is the second like big effort. The last time was like in 2017, and now it was reintroduced this year, and again, like the powerful California Nurses Union was a sponsor of this. And if California, which is, can get its a Medicare for All type healthcare system passed here, would be huge because we're the 5th largest economy on the planet, right? So then that could, pave the way and create a model for other states to model their Medicare for All type systems. But also show voters in those other states that, hey, it's possible, right? California, which is the largest state with the most people and the 5th largest economy in the world, they were able to do it, so we could, we should be able to do it too. So the state of AB 14, unfortunately right now, it didn't make it through the Assembly Rules Committee. And there's like a whole bunch of reasons related to that. I don't know the exact reason, but I'm guessing Newsom getting recalled has like significant impact on that. So for now it's been shelved, and it can action on it will be taken up in January of 2022. So we're just gonna have to wait a bit. But the California Nurses Union, total rock stars, are making, and other grassroots organizations in the state are keeping AB 1400 fresh in Californians' minds, right? It's not going away. It's just on pause for the moment. Okay, then we have New York. So in New York State, they have the New York Health Act. It is A 6058 and S 5474. And the hashtag for that is actually pass NY Health. And they're actually in a timely situation right now. So there's like 5 weeks. And there is, what is it? The campaign for New York Health. So they're organizing and mobilizing people around calling, arranging phone banks and trainings to get, New Yorkers to call their local assembly representative and state senator to pressure them to vote yes on the New York Health Act. So lots of things happening, and I know, and I saw too that DSA chapters are also organizing, phone banks and door knockings, and again, putting out social media and other, efforts again to get New Yorkers to pressure their local assembly person and their state senator. So that is active. So I will also put in the show notes, if you would like to help out in these in any of this, you can go there, and I'll put the link there with information. So New York, I mean, this is huge. So again, New York is another huge state. If they get their Medicare for All type system passed in New York, again, that would be huge because New York has got like a lot of people, a lot of complex systems there too. So that can, again, New York could be the first state and help pave the way for the other states to get Medicare for All type system. Okay, another timely thing, in Washington state, we have the whole Washington campaign. So they have an initiative number, and it's I-1362. So right now, they are in the phase right now of collecting signatures, because they need 405,000 signatures in order to get onto the ballot. So they're currently at 182,435 signatures. So they still got a way to go, but again, I will put in the video description a link if you want to volunteer to help. If you're in Washington State, you know, if you want to help collect signatures, so they can reach that 405,000 signature goal that they have. So it can get on the ballot and let the people decide, you know, yes, we want health care coverage for everybody in the state of Washington. Okay, so that is timely, and they're actively looking for volunteers to collect signatures there. So, okay, moving on, in Massachusetts, in Massachusetts, it's S766. It's called the Medicare For All in Massachusetts Act. It was introduced a few months ago. It is currently in the Joint Committee on Healthcare Financing. So it arrived there April 13th, but a hearing has not been set yet there. So there is a Medicare for All Act bill in Massachusetts, right? So that's happening. That was one I didn't know about. So that's really cool there. So moving on, we also have, let's see, Maine. Okay, the next one is Maine. HB 1045, an act to support universal health care. Okay, so in Maine, they are now, so they have something, you know, a bill in Maine too, that now it's kind of sitting again, like in legislative, it's sitting in the legislative process, but Maine has a bill going on over there currently. So if you live in the state of Maine, now's time, you know, go get some information, you know, go look up the number. It's HB 1045. Call your local representatives and ask them about it. Okay, so that's in Maine. So like, these are like state level things that are happening. Okay, so on the county level, something I found in Maryland, so Maryland, so in this county in Maryland, so they were, you know, wanting to again get support for Medicare for All. So in Prince George County, they passed a resolution unanimously to support Medicare for All, and they're the first county in Maryland to do this, to pass a resolution like this. So this is an example, again, back to the micro level of, you know, organizing and mobilizing to get Medicare for All, you know, coverage for you know, all, you know, for Americans, for us to have, like, not suffer in this current system anymore, right? So that's like a cool thing. So on other county levels, you know, counties can pass resolutions saying that they are in support of a Medicare for All type act, whether it's on this, you know, the state level or on the, you know, federal level, like, because we need all the support we can get. I know one of the things with going back to CalCare, AB 1400 here in California, the California Nurses Union, what they were doing, one of the organizing things they did, and I know about this because I was in some of the calls, is that they were setting up, mobilizing and organizing in assembly districts, so that, you know, they were getting like leaders and organizers in each of the assembly districts to you know, get together and then plan a meeting with our assembly representative and go talk to them about supporting AB 4, you know, vote, you know, that they were going to support and vote yes on AB 1400. So we were doing that. We were in that process before it got shelved. So that was like organizing happening. And I also know, okay, back to the macro level with HR 1976, right, the Medicare for All Act on the federal level in the House, the National Nurses Union, they were also organizing in congressional districts. And I know about this too because my rep, John Garamendi, my House rep, is not a co-sponsor of HR 1976. So um, we've been having organizing. We had our first organizing meeting online to plan to arrange to go meet him and what we're going to say and do. So I know that that is happening too, where the again, the nurses union is trying to organize and mobilize and get things going with House reps who have not co-sponsored Medicare for All HR 1976. Okay, so that's on the macro level. But anyway, and then lastly, this is not Medicare for All directly, because in some states, their pathway to getting Medicare for All is going to be different. So in Nevada right now, they have a bill, SB 420, which is about introducing a public option in the state of Nevada, right? So the Nevada State Democratic Party is behind this, okay? And as many of you know, it's that the Nevada Democratic State Party has been taken over by progressives, mainly burners. So they support this, right, as a way to move into Medicare for All, right? Let's get to a public option and then move over there. There was a read a story. There was they had their first public meeting around it, and there was like fireworks and stuff. A lot of heated discussion, of course, right? Because you had the special interest groups, then you had the progressive groups, and then you had party group, like all these groups with all their opinions about the public option. So, but a public option in Nevada is on the table right now, and in terms of the progressive groups, they're viewing that as a stepping stone to get Medicare for All eventually in their state, which again is another model that other states can use to again make their way into Medicare for All on the state level. So those were just some of the states' activities that I found going on. If you are in another state that I did not mention, please leave a comment. Let me know. I'm creating an ongoing list of some of these state level initiatives and wins, even on county or city levels, where it's even if it's not like Medicare for All on the state level or county level or like the whole bill, maybe they're doing chunks and pieces, right? Like where they're getting, like what Bernie's trying to do with Medicare is get like teeth, dental, hearing, and vision covered under Medicare, right? So maybe like there's chunks and pieces that the states are doing, that eventually like are part of the bigger Medicare for All bill, but they're gonna do it in chunks and pieces. So that could be happening too, right? There's all these possibilities of different things happening. So somebody's there. So anyway, okay, so just to wrap this up, again, this is a discussion partner, a discussion starter. I'm not saying that like this is the way we do it, but I personally am kind of liking this idea of starting at the state level, because again, it's because at the macro level and the federal level, it's going to take a long time, an enormous amount of time, because to get on that level, we've got to elect more Congress people and senators. We have to get the votes to get it passed, and then we have to elect a president that will actually sign it into law, because Biden has even made it clear that even if the House and Senate pass Medicare for All, he will veto it and not sign it. So that to get Medicare for All on the national level could take years. I mean, it will take years, years and years. And so on the state level, we could get it faster, right? And I say faster relative to the national. It could still, it will still take years and years on the state level. Because again, there's got to be enough momentum and enough, again, organizing and mobilizing happening on that. And and to be honest, there has to be a shift in consciousness that happens where the majority of the collective consciousness agrees that healthcare is a human right, and that the social contract is that our tax dollars will be used to build this robust system to cover everybody, again, in healthcare from the moment you're born to the moment you die, right? That again, that coverage should be there, and you would think that this would be common sense, but it's not. I mean, like we're a lot of us who supported Bernie and other progressive candidates. Okay, we believe that healthcare is a human right, but what does that mean in actual implementation, right? So some people think public option is good enough. Then there's us who are like, no, we want like a full Medicare for all, universal healthcare coverage, like all the other top countries in the world who have that for their people. Like the United States is the only top country that doesn't have it, and it is frankly, like about time that we change that, because no one should have to suffer, or go bankrupt, or go into major debt or die again because of healthcare costs. And the fact that we couldn't even get, an emergency Medicare for all type thing passed during a pandemic, right? Which, Bernie and Congresswoman Jayapal were trying to get even just an emergency Medicare for all pass for the COVID pandemic. Like that couldn't even happen. So, that's where some consciousness, shift is going to have to happen, and we get more people on board with like, yes, healthcare is a human right, and yes, we want the social contract to reflect that our taxpayer dollars are going to reflect care for everybody and not just for a few. And that, again, healthcare is not a privilege, and it should not be tied to a job as a benefit. Like it should, everybody should have health care. So let me know your thoughts. Like, what do you think about getting Medicare for all passed on the state level, as a pathway to get it passed on the federal level? And if anything, if you have particular, like in New York and Washington, since they are actively doing things right now, like in Washington, again, they're collecting signatures, and in New York, right, they're organizing phone banks and door knocking, because there's like this 5-week timeline. There's a deadline coming up with that. So if there's anything happening with that, like leave a comment, let me know. I will help signal boost that. If you're in other states that I didn't mention, and you're doing initiatives and things around Medicare for all, or if your state is doing like what Nevada's doing with a public a public option bill, let me know about that, right? So I'm creating a list and starting to collect all of this stuff too. All right, so let's get it all, but one way or another, we are gonna get Medicare for all passed in this country, because healthcare is a human right.